Welcome to the Explainer. Today, we're cracking open the Diagnostic Detectives Toolkit.
Well, they act like detectives, piecing together clues to solve some truly life-or-death puzzles.
Okay, let's dive in. First up, sometimes just a simple change in view can reveal everything. It's a brilliant, simple move. The problem is trapped air, and the solution? Just gravity. Here, the real clue is what doesn't change. If that lung stays puffed up, something's blocked. What's really interesting is how detectives spot clues that aren't even diseases. They find signals in the noise. See this? It looks kind of weird, but it's a totally harmless quirk. A great detective knows when to ignore a clue. And check this out, a simple rule of anatomy that instantly tells doctors where a mass is hiding. Okay, now for the red herrings. These are the tricky cases where things are not what they seem. So a scan shows some really alarming activity. The first thought, it's gotta be cancer. But hold on.
Turns out it's not a tumor. It's just the body healing itself. Knowing this avoids a huge mistake.
You see, one tiny detail, calcification, and suddenly the entire list of suspects changes completely. Now, when a mass is found in a kid's chest, the first question isn't what, it's how old. And this is a brilliant shortcut. The child's age can point you right to the most likely suspect.
All right, let's move on to identifying the suspects by their unique fingerprints and telltale signs.
Asbestos exposure leaves a very specific trail, like footprints that stop just short of the corners. When you're looking at a lung nodule, these are the signs that put everyone on high alert. So here, the patient's own immune system is the clue. It separates a harmless squatter from a deadly invader. This specific combo of findings, it's a classic signature for a particular infection in AIDS patients. So all the clues are on the table. It's time to close the case and make the final call. In lung cancer, this is the number that can change a patient's entire world. Getting to this stage means surgery is off the table. It's an absolutely critical threshold. Even different types of the same cancer behave differently, and that helps detectives tell them apart. And here's one last crucial rule. A good detective always knows when to throw out the rulebook. It makes you wonder, right? Is diagnosis just science, or is it the art of seeing what everyone else missed?